All right, here we go. So good evening, everyone, and thank you for joining us for the IDF Forum flu season. What does the PI community need to know? My name is Adam Freestone. I'm the Senior Creative Director at IDF, and I'll be your forum MC for this evening. So before we begin, this is just a quick disclaimer that the information presented during this event is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with questions concerning a medical condition. So on behalf of the Immune Deficiency Foundation, welcome. Whether this is the first time you've attended an IDF forum or you have joined us before, we are honored to have you with us tonight. IDF's mission is improving the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. This means we are committed to serving you and providing you with the tools and resources needed to be your own best advocate and a champion for the PI community. It is by offering these tools and resources that IDF can fulfill its vision of seeking to ensure that everyone in the US affected by PI has a fully informed understanding of the PI diagnosis that affects them, all available treatment options, the expected standard of care, all of their opportunities for connection and support within the PI community. So IDF forums are made possible by our wonderful sponsors. It is due to their partnerships and contributions that IDF is able to provide programs such as this one and services to everyone in the PI community. So I'd like to take this moment to thank our 2021 sponsors: CSL Behring, Grifols, Takeda, Horizon Therapeutics, Octapharma, Accredo, Adma Biologics, Bioproducts Laboratory, Farming Healthcare, X4 Pharmaceuticals, Kedrion Biopharma, and Soleo Health. So now I would like to welcome and introduce our presenter, Dr. PJ Maglione. Dr. Maglione is a physician scientist in the Pulmonary Center of Boston University School of Medicine. His research efforts in the areas of primary antibody deficiency and B-cell biology have been supported by numerous sources, including the Thrasher Research Fund, Clinical Immunology Society, Primary Immune Deficiency Treatment Consortium, American Association of Allergy, Asthma, and Immunology, Immune Deficiency Foundation, and the National Institutes of Health. Dr. Maglione studies human B-cell biology, particularly in how it relates to and is informed by primary immunodeficiency disorders. So in addition to running a research laboratory, Dr. Maglione provides clinical care for patients with immunodeficiency disorders at Boston Medical Center and has particular interest and expertise in common variable immune deficiency, which we all know is CVID, and its related complications, including chronic lung disease. Please join me in welcoming Dr. Maglione.
Thanks. Thank you so much for the introduction. It's my real pleasure to talk about this particular topic of flu, which in some ways is a bit of a forgotten virus since we didn't hear a lot about it last year. But this year things can be different, and well, I'll get to it and I'll explain why. And I'm glad IDF is doing a session on flu this year and keeping it in people's minds. So there's a number of things that I would like to talk about today relating to influenza or flu. Some of it we'll just go through the background of what is influenza, what are the symptoms associated with this infection, how is it transmitted, and how you might prevent that transmission. And then, some of the treatments and vaccines that are available, and questions that may be about when you should get them. And then questions about those of you who may be on IgG replacement therapy, how does that factor in, and how does that protect against flu, or does it not? And I won't talk about COVID in any significant way because, well, you have a whole separate session on this topic, and there's no way I could speak about it in this limited time in addition to flu. But I will mention briefly about how to differentiate the flu from COVID, because that could be important, at least to understand. And then, I'll finish with a little speculation and about what we might expect from flu this year. Of course, that could end up being entirely wrong, but I think it's an interesting topic to discuss nonetheless. So start by discussing what is influenza. Influenza or the flu is caused by the influenza virus, which is a negative sense single-strand RNA virus. For those of you who are biologists in the audience, it's quite notorious for its ability to alter its genome every year through processes known as genetic shift or genetic drift. These are two of the fundamental ways where the most immunogenic proteins, or important immunogenic proteins anyway, of the virus can change themselves from year to year and evade immunity. And that's a concept that we'll talk about. We'll visit in this talk because it's very important to why we need to be vaccinated and why we get epidemics of the flu on a nearly annual basis. Now, in the past, this is pre-COVID data. The CDC estimated that the flu occurred in about on the order of hundreds of thousands of hospitalizations each year. Now, the exact number can fluctuate quite a bit from year to year, and I think we may remember some of the worst years, H1N1 year, and some of the years where the flu strain is particularly pathogenic or particularly infectious, particularly dangerous. There are these years that are worse than others. And so the deaths can be in the US in the range of, again, tens of thousands of deaths annually. Now, this can be kind of dwarfed in your minds when you think about what we're going through right now with COVID, but this is, of course, not an insignificant infection and one that we had been dealing with every single year. So what are the symptoms of flu? Well, we can start with the most common ones, and those are typically fever and aches and pains, myalgias, which are muscle aches, general malaise, or just that feeling of quite severe fatigue. Then you get some upper respiratory symptoms, things like runny nose, sore throat, cough, and then headache can be a feature as well. And this is what you're most commonly going to see. These are kind of like your flu-like symptoms when you hear this terminology. Now, there could be more severe symptoms associated with flu. These can involve more extensive inflammation of the muscles or even of the heart, involvement of the central nervous system, or something that's particularly important and can perhaps lead to some of the greatest morbidity of this infection, and that is superinfection. And this is a term to describe when there is an infection on top of an infection. So influenza has this ability to sort of change the environment of the lung to make it more susceptible to another infection, and particularly bacterial infection. And this superinfection can happen simultaneously or can follow it by days or weeks after the flu infection. And this is really one of the biggest problems that patients with the flu can face. It's maybe not even necessarily the flu itself, but the superinfection that can occur as a consequence of the flu. Now, in most individuals, and this is for immunocompetent individuals, of course, recovery of these symptoms occurs in 5 to 7 days. But even in healthy individuals and in many immunocompromised individuals, symptoms of fatigue and malaise and some of the respiratory symptoms can persist for weeks. It can be difficult to clear. In many individuals, it's a fairly benign infection, lasts about a week. But in others, it can be something that lasts longer and has, as I mentioned, some of these more severe consequences. So how is influenza transmitted? Well, these days, we think about respiratory virus transmission a lot more than we probably ever did. We live in a society that's constantly debating the utility of masks and what masks and all of this. So I think people think about this so much more than we ever did. And maybe that's a good thing to some degree. Of course, it gives rise to a lot of debate and animosity at other times. So how is it transmitted? Well, it's transmitted in respiratory droplets. Now, you may be familiar with this idea, but these respiratory droplets can be two sizes for the simple discussion here. And these are small droplets, which are less than 5 micrometers or microns in size. These small droplets can lead to what's known as airborne transmission. And you hear a lot about this with COVID. This is something that can persist in the air and can be, it isn't weighed down by heavy droplets, so it can kind of float. And that's where you get this airborne transmission. But these small droplets, they don't accumulate on surfaces in the same way. And so you don't get that contact transmission when there are small droplets. Now, when there are the larger droplets, which we say are bigger than 5 microns in diameter, you have a lot shorter distance of travel, generally less than a meter. So this is where the idea of distancing becomes a lot more relevant when you have an airborne pathogen versus when you're having droplet transmission. But here you can have direct contact or transmission indirectly through contact. And this is why hygiene relating to the hands can be important, relating to contact to certain areas that someone may be in contact with frequently, and then someone else may come into contact, like a phone, for example, or computer keyboards that are shared. And so the idea is important to think about these two, that it's complex how a respiratory infection can be transmitted. It's not really clear which is the most important way that influenza is transmitted. Generally speaking, we think a lot about droplets being the important. That's the conventional teaching, although there's a line of research that has been pointing at the potential of airborne transmission being significant as well. But we do know historically, and when we deal with influenza patients in the hospital, we think about the large droplet transmission, and we usually utilize droplet precaution because this is largely thought to be an important way that flu is transmitted. Now, it is fairly contagious. Now, we live in an age of, the Delta variant of COVID. So when we talk about contagious, nothing seems to be so impressive anymore. But we used to think of the flu as pretty darn contagious too. In studies, it could have up to 30% household transmission and school transmission in some studies and some reports. So it itself is pretty contagious. Now, the risk factors are very reminiscent to what we think about with COVID, older individuals with comorbid conditions. But what's interesting is a couple of things that are separate concerns that seem to be very important with flu and haven't necessarily yet been linked with COVID. But that is the younger age, less than 5 years, is a risk factor in influenza. That's why those of you who have kids probably know this, young kids, about getting the flu vaccine, and is a important thing that pediatrician will push for. And we're so unclear with COVID yet. There is some evidence that more kids are being hospitalized, but it's not clear whether that's just because there's more infections overall or whether it truly is the Delta variant more pathogenic in children. That's remaining to be seen. And then, of course, those of you here are likely immune compromised in some degree, and we certainly know that influenza can be worsened by conditions of immune compromise. And there are some primary immune deficiencies that have been identified that lead to an increased risk of flu, although those are very rare, have been reported in only a few cases. So how do you prevent flu? So it comes back to the idea, some of the ideas I spoke about the previous slide about droplet transmission, which is an important mode of transmission for flu. So first and foremost, you want to avoid sick people, and you yourself want to stay home if you're sick, so that you can also aid with preventing transmission from the virus from yourself. Hand hygiene is very important for those reasons I talked about, those large droplets that can accumulate, that can be on surfaces, that can end up on your hands. Don't touch your face, because it's the mucous membranes of your face that can lead to viral entry, places, things like your nose, your eyes, around your mouth. These are areas where you can get this transmission. So you want to avoid that habit of touching your face. And you want to routinely clean frequently touched objects, those doorknobs, keyboards, phones, to help remove germs. Again, this idea of these large droplet transmissions. And if you are going to work, make sure your workplace has an adequate supply of things that can help you keep things clean. Soap, hand washing, like with alcohol-based hand rubs, disposable wipes, paper towels, all these things should be there. Because this is a key way that influenza is transmitted. So what can we do about flu? What are the treatments, and do we have vaccines? Well, you probably all know we do have vaccines, and we have two flavors of vaccine. You have the live attenuated, or what we call the inactivated or dead vaccines. So there is a type of live attenuated flu vaccine. It's a nasal vaccine. It is out there, but it's not recommended for individuals with immunodeficiency. It's not really frequently given. But if you do encounter it, it's important to remind your doctor, or if this is your child, to remind them that in immunocompromised individuals, we tend to stay away from live attenuated vaccines, because there is a risk the vaccine can cause an infection in someone who is immunocompromised when the vaccine is live. But this is something to discuss with your individual doctor. Obviously, those of you in this session have a broad range of immune deficiencies, and some of you, maybe this isn't contraindicated, but it's important to talk to your doctor about that and be aware that in many with immunodeficiency, we don't give live vaccines. So the vaccine you're most likely to encounter are the quadrivalent inactivated vaccines. So these do not have live virus. They have the key viral proteins, and they represent 4 different flu viruses typically. That's why we call it the quadrivalent. And what they do is they try to guess what is the strain that's going to be. And in every year that we've ever had this vaccine, this has been an relatively easy process, because you look at flu at other parts of the world before they've come to the US, and you can see, okay, well, what are the strains that's out there? Well, because of COVID precautions, we haven't seen a whole lot of flu. And so this is going to be a little bit more challenging this year, I think. But I believe the concept will be the same, and we're going to try to predict what strains are there, even if the levels are low as they are now. Now, there is a high dose vaccine, where it will either have, there are vaccines that are aimed for those who might not have as strong of an immune response. So there are 2 types of that. There's a high dose vaccine, which has 4 times the antigen, so 4 times the immune stimulating protein of the regular vaccine. Or there's something known as an adjuvanted vaccine. It has something else in that vaccine that kind of turn on your immune system a little more robustly. These are typically recommended for those that are 65 and older, because those who are older tend to have a little bit more of a mellow immune system, and they don't respond as vigorously to vaccines. And so this is a helpful way to get a good immune response, to use one of these vaccines. Now, depending on your individual case of immune deficiency, this may be an interesting and a useful vaccine for you, and it's worth discussing with your doctor. I often, in some cases, will use these high dose or adjuvanted vaccines in my immunodeficient patients, at least some of them, in the hopes of stimulating an immune system. And again, I hate to sort of continue to reference COVID, because I know you have a whole separate session, but it's helpful because I think it illustrates the concept, as now there's been approval for a 3rd dose of COVID vaccination for the same idea. Like, just you might need a little more oomph to your immune system to turn it on. That's what these vaccines can do. So the concept is somewhat similar. So something to discuss. I'm not saying everyone should get this vaccine that's here, because I don't know your individual cases, but I certainly think it's worth a discussion with your doctor. So if you were to get the flu, well, what are some of the things you could do about it? Well, besides, talking to your doctor and following their recommendations, the usual things we talk about are rest and fluids, which are, fundamental to flu recovery. And an antiviral is available, Tamiflu. So many of you are immunocompromised and would probably be considered at a higher risk. So this is a therapy you most likely would consider getting. And it's most likely to provide benefit early on. So you have to be good communication with your doctors. Be vigilant. I know many of you are, particularly in an age where of a pandemic. We're thinking about what is this infection. Let's not only be thinking about COVID. Let's think about the possibility of flu, and are you getting tested for flu? Because the benefit is probably best if you get this within the first 48 hours. This antiviral therapy. But there may be some benefit even after that. So let's talk to your doctor about it. Make sure this is on people's minds, because many of you in this session, it would be a good candidate to get this. So when should you get the flu shot? Well, we're coming up to that. So that's why the session is great timing. We typically do the flu shot in the fall, before the typical flu season begins. Now, I don't know when the flu season will begin. This year, we didn't really have one last year. It all depends on, maybe regionally, what's going on regionally, in terms of, the different public health measures that are in place. It remains to be seen. But typically, the CDC is always recommended by the end of October, and I think that's what we want to keep to, unless the data tells us otherwise. And the reason for that is too early vaccination may not be a good thing. There's some concern that an early vaccination, and again, in the typical flu season, if you were to get vaccinated, in July, then it might not have protection through the full flu season. So you really want to make sure you don't get it too early. Although, again, as I mentioned, the caveat is this year, we're not really sure what the timing is going to be. So most likely, we're just going to want to stick with the typical recommendations, which is, by the end of October. And you need to get the flu shot every year. And we'll talk about this maybe in a bit more in this talk. But as I mentioned in the beginning, the flu vaccine undergoes significant genetic changes every year, historically anyway. And this causes immune evasion, meaning it can evade the immune system. So what you were vaccinated against last year may not protect you this year. And so that is the important concept. And so we are recommending to get the flu shot every year for that reason. Now, some of you may say, well, I don't make antibodies. What's the utility of the flu shot? Well, the utility is that you might get a T cell response. You might get other aspects of your immune system to respond. And since it is not a live virus, at least the ones you should be getting, it's one of these inactivated vaccines. It's very safe. And so the benefit far outweighs any risk. So it's true, you may not get an antibody response, but there have been studies done in patients with antibody deficiencies like CVID that show that they do mount a T cell response. So you can get some benefit. And secondly, not everyone in the room has exactly the same problem. And so some of you may get some antibody benefit. And also, antibody deficiencies can be a spectrum. So it can mean that you don't respond to many things, but you still might respond to some things. And we can't always predict what you're going to respond to. So it is a good idea to give it a shot, even in those who are antibody deficient. So what about those of you who are on IgG replacement? Does that protect against the flu? Well, typically, the current influenza strain, antibodies against that strain are not typically present in the IgG product. As you know, there's kind of a delay between when plasma donors come in to give their plasma, right? They have to have the antibodies against that strain, and then it ends up in the product, significantly later than when they were donated. So when the flu virus first comes along, you don't have donors that have the antibodies yet. And even if you are later in that flu season, someone's donating plasma and might have antibodies. Well, it's not going to get to you in time for that season. So typically, there isn't protection from that current strain. Now, it may help against superinfection. For example, with the bacteria, as I speak to, that might come in and cause that superinfection that's so problematic, well, you might have antibodies against those in the IVIG or the sub-Q IgG, whatever product you're using. You might have that protection. So there is a thought that it could help prevent maybe some of the severe complications of flu. So you do have that to think about and to know that possibility is there. And there may be some benefit of cross-reactive antibodies, by which I mean maybe it's not specific for the current strain, but it is able to recognize something about that current strain because of perhaps a past strain or some related protein that's there that you have antibodies against. There may be some protection, although that has not been conclusively demonstrated. But I just mentioned that just to give some optimism here that it isn't so black and white that, okay, there's no benefit from the IgG replacement. There may be something relating to the superinfection and perhaps beyond that. So a key question this flu season will come up is, well, how do you differentiate flu from COVID? Well, COVID, we generally are been focused on the airborne transmission as being a major feature of this. And we've heard a lot about that. And again, you'll have a whole separate COVID session. Influenza has a major component of the large droplet transmission that we talked about. So we really have to think about, that aspect of your hygiene being very important, the contact transmission. Some of these things have been de-emphasized a little bit because so much emphasis has been put on the COVID airborne transmission as of late. We cannot forget how this is an important part, at least we think, of influenza transmission, thinking about the large droplets dropping and landing on places, contact. We have to, do these things. Hand hygiene is important. Surfaces being clean are important. In general, we think COVID of being more serious, although clearly influenza can be very serious. I showed you the mortality And there can be COVID with, at least in immunocompetent individuals, with very little symptoms that on occasion as well. So we certainly know both viruses can span the spectrum of symptoms. COVID has this really kind of, unique kind of standing out feature of it where there's a loss or a change in taste and smell, which is kind of makes you really think about COVID if you have those symptoms. Flu tends to come on a bit faster. Symptoms typically within a few days, and COVID might take a little bit longer, and it can take, even longer than that, in terms of up to 2 weeks. And that was a real challenge. If you remember, as we were talking about quarantine periods and all of this that you guys have all been dealing with COVID, flu tends to kind of come on faster and disappear faster. It's not as contagious as long. Usually just a few days for flu in terms of its contagious period, far longer for COVID, which is probably about 10 days or so. Maybe shortened now that we have the vaccine, but historically pre-vaccine data, that's what we were discussing with COVID. Flu much shorter. COVID has these more prone to these super spreader events, which harkens back to the concept of the importance of airborne transmission to that infection, and not quite the same super spreader events will be linked with flu, at least typically. So lastly, I wanted to end with, well, how do we think the flu season is going to look? Well, I don't have a crystal ball and I don't know quite, but optimistically, we haven't actually seen, a lot of flu cases yet in the Southern Hemisphere, which is just coming out of its winter, where you would have expected to see flu. And historically, we saw very few cases. But as those of you who may be following closely, how countries are behaving and responding with public health measures to COVID, in many of those places, public health restrictions are still in place. The behavior changes that people have undergone because of COVID are still in place, even if some of the restrictions have been removed. So we haven't seen a lot of flu yet, even entering now this sort of period where vaccines are available and stuff. So it's hard to predict what we're going to see. But if you look at past years, which I have on a slide there, typically you'd start to see, an increase heading into the winter in North America. But we saw the big impact of the COVID-19 lockdown in March of 2020, which basically, got rid of flu. So it gives me the optimism that a lot of the behaviors that have become rote memorized by people, even in places that may have, relaxed some of the measures, the ideas of people hitting that like hand sanitizer more frequently, washing their hands more frequently, wearing masks, all these things are going to reduce flu and are going to protect individuals and protect those around them. So, I want to end on an optimistic note. I have no idea what's going to happen, but so far, at least in what we've seen in the Southern Hemisphere, it's looked pretty good. There is a lot of concern about a rebound flu outbreak, the idea that now we live in this post-vaccine world, that people are going to behave in a way that might spread the flu more. But I think, frankly, because of the Delta variant of COVID, it has maintained people's vigilance. And so we may not see that this year. And that might be more of a concern perhaps in 2022, but it remains to be seen. And so with that, I think that's my last slide. So I hope I filled my time up adequately, but I look forward to answering questions.
Awesome. Thanks so much, Dr. Mclean. That was great information. And yeah, there's definitely questions pouring in. So
okay, good.
All right, so Q&A time.
Okay, here we go. I'm Kathy Antela, a Vice President of Education at IDF, and I will be asking Dr. Maglione the wonderful questions that you submitted before tonight's forum during the registration process and during the forum tonight. Now, some of these might be a little repetitive of what Dr. Maglione talked about, but we're going to ask them anyway in order to clarify some of this great information he has shared with us. And you feel free to continue to submit questions throughout the Q&A, and we will have Dr. Maglione answer as many as possible in the time we have left. So first question is, please clarify the amount of time a person should wait after the third COVID vaccine, or in between their third COVID vaccine and their flu vaccine. How much time should you have in between the two?
So, as with all these answers, I encourage you to speak to your individual doctor that will know you best. But my opinion about this is simple. I have a simple approach. The CDC has recently changed its guidance regarding whether you can get a COVID vaccine at the same time as a flu vaccine, or as another vaccine. And now you don't have to wait. They used to ask you to wait 14 days. That's not the case anymore. So I'm actually not advising that they have to wait any X amount of time. It's based on, your convenience. So the third dose is probably, being administered right around now, because we have approval to do this. You're probably getting this now or soon. As I mentioned, we're waiting a bit on the flu shot to try to aim for that, October time, by the end of late October. So I think that's fine. If you're getting your flu shots, if you're getting your third dose of COVID vaccines now, and then you're going to get your flu shot in October, I think that is fine. And there's no concern, as far as from my perspective, about them being too close together or needing to space them out or anything like that. And as I mentioned, the CDC has recently changed its guidance and not even advising anyone to have to wait between doses of vaccines. But again, you want to speak to this to your individual doctor. There might be an individual aspect to your case. That's why, they want to wait. And so I can't speak to that.
Thank you. And also, please clarify the amount of time between an infusion and the flu shot, whether it be a subcutaneous infusion and the flu shot and intravenous infusion and the flu shot. So
you might not be surprised. I have a similar, simple opinion about this as well. I mean, I don't overthink. I don't think very much about these concerns. I don't let them worry too much, because I know many of you have docs that want to wait until the nadir or the lowest point of your antibodies after your infusion before getting a vaccine. And these are concerns that exist. But, my concerns for them are really, minimal, because I don't think that there is a lot of evidence of interactions with the COVID or the flu vaccine. So the idea is, theoretically, right? The theoretical concern is that there'll be antibodies in your product that will neutralize the vaccine so that they don't work. But these aren't necessarily going to be relevant to the vaccines we're talking about. Number one is the flu vaccine we're focusing on today is a seasonal vaccine. And so it's unlikely to be, if you have antibodies in your IVIG that can intercept the vaccine in such a potent way, you don't really need the vaccine, right? So the whole point is that you don't have those antibodies, and you need the vaccine for that reason, to stimulate at least the T cells. If you're not going to make antibodies, stimulate some of your immune system to respond. So again, I don't want to, there might be individual cases, and you should talk to your doctor and listen to the doctor that knows you best. But I think I have a simpler approach to these things. I don't overly worry about that, because I don't think that there's going to be a major interaction to something that you don't already have antibodies to. So I think these are theoretical concerns that haven't really borne out too much in terms of having hard data that says this is going to block your vaccine efficacy. But I do know that many docs are concerned about this and think about it. So you should listen to who knows you best.
Should I get one flu shot or two during the season? Should a person get one in August and maybe one later in the year?
Yeah, we don't have evidence for that. I think that the main thing that I would mention, as I mentioned in the talk, is that there are formulations of the vaccine that are aimed at the 65 and older crowd, which is the ones that have either more of the antigen, or that immune stimulating protein, or have what's known as an adjuvant added. which stimulates the immune system more to respond more robustly, I think I would have that discussion with your doctor to sort of get one of those vaccines, because those have been utilized in immunocompromised individuals. And so we know a bit about these things potentially helping. The strategy about, giving the flu shot twice, I don't think is, we have evidence to really recommend that. And we're not seeing a ton of flu as far as I've seen in the data, a ton of flu in the community right now that justifies you to rush out and get the vaccine now and then think about getting it again. So I think I would stick with this plan of aiming for that October time, and maybe having discussion with one of these more, robust vaccines with your doctor.
Why do some people say the flu shot has made them get so sick, get the flu, that they don't get the shot anymore?
I don't know. I've heard that very often, and I do not know where that comes from. I don't know. But as many of you know about, maybe aware of, is terms of vaccines are meant to stimulate your immune system, right? They're meant to activate the immune system, which can involve things like production of proteins known as cytokines, which can cause some of these symptoms that you would feel, but it's really part of your immune system working. A fever is actually caused by your immune response. It's not caused by the virus or the vaccine itself. It's caused by the immune response to those things. And so some of these symptoms are truly representative of your immune system working and working well. And so I think that's probably what people are feeling. They're feeling this. And it could be, you asked specifically about the flu shot, and it could be the fact that, hey, we're dealing with something that we vaccinate every year, and there may be some parts of your immune system that recognize it again. Even though we need the vaccine every year because the virus changes, there may be some aspects that the immune system can still recognize, and so therefore gives you some of these symptoms a little more strongly because you've got a good, healthy immune response, at least in these individuals that are feeling this. So that would be my speculation, but I don't really know, but I've certainly heard that many times.
Have you seen people in your practice that get sick with the flu after the flu shot or flu-like symptoms?
Yes, and that's a fact. No vaccine is 100%, right? And we're learning that right now, with COVID. That's been big news this summer. So, if you expect the vaccine to never have a breakthrough infection, that's just, that's not the flu vaccine. And the flu vaccine, frankly, is not as good as a COVID vaccine. Its data has never been as impressive as a COVID vaccine. So, those cases we had heard of, and they happen, but they're far outweighed by the protection that the vaccines offer, which is largely, keeping the severe infections at bay. So an individual that's got sick after getting the flu vaccine, you can only wonder about how sick they may have been if they hadn't got the vaccine. And so that's the thing to think about is to recognize that what these vaccines do is more than just a black and white, you don't get the infection or you do, but really the gradation of the infection you might get. And if you still get an infection, odds are it won't be as severe as the infection you would get if you weren't vaccinated.
And if you typically have even a slight reaction, body aches, low-grade fever, or fever after the shot, and you take Tylenol or Advil before or after the shot, does it make the flu shot less effective?
I don't think so. I think certainly after the fact, we know that it's probably no issue. Think about this. We do this with kids all the time, right? When you take your kid to get vaccinated, your pediatrician says, "Oh, well, just give them some Tylenol if they get a fever or something." We never thought about that, and it became an issue with this COVID vaccine that, because it's pretty robust, it became an issue with adults. So adults weren't used to that. Our kids put up with this all the time, but the adults they're the wimps, and they want to know, what do we do about this? So I think afterwards, it's not a major issue. Now, there was some recommendations at the very initial point of the vaccine, when the vaccine was coming out, was to not take, these medications, the ibuprofens and, the naproxens and things before getting the vaccine, because they were worried it would, suppress the vaccine from working. But I haven't seen real evidence of that really being the case. These aren't, some of you on this call probably know about real suppressive agents. You may have been on them, some real agents. And, if you have a real autoimmune disease or you have a real, serious condition, it doesn't get better with ibuprofen. It's not really suppressing your immune system in any major way. You guys know the agents, some of you anyway, know the agents that do this. And those are the ones that we really have discussions about, well, how might that affect the vaccine response? Far more significantly, we never really, expect to see a lot of immune suppression from things like ibuprofen. So I suspect it really doesn't have an effect. But so I would say I wouldn't worry too much about that. I think it's far more important to get the vaccine, and if not being able to take ibuprofen is going to prevent you from getting the vaccine, and it's that black and white for you, I would say, well, take the ibuprofen and get the vaccine. It's that important.
During an active fungal infection, should I get the flu shot during that time?
Well, it's hard for me to answer not knowing the full details of your case. So I would say, generally speaking, and I don't know how you're, generally speaking, I would say, it's really hard to answer. I would say generally it's probably going to be okay, but you really want to talk with your doctors. I just don't know the circumstances. If it's a very, very severe infection, sometimes we don't want to do a vaccine because, one of the other things is when you have an active infection, your immune system is kind of occupied and it may not respond to the vaccine because it's already all these inflammatory mediators are up, and it ends up sort of kind of having an immunosuppression effect, believe it or not. It's sort of this idea that you need to have sort of breaks on your immune system and exhaust the cells so they're less responsive. So actually, it really depends on the severity of your infection. But generally speaking, if you have a minor fungal infection, like say you have a toe infection, fungal toe infection or something like that, yes, you could get the flu vaccine, but it depends on the infection. So certainly you want to discuss that with your individual doctor.
We have a couple questions about one person has been pretty isolated at home due to COVID, and they are thinking, should I get the flu shot at the doctor's office, or is it just safer to remain home and stay isolated and skip the flu shot? And then we have another question where somebody is saying, if I plan to stay masked because of COVID, do I still need the flu shot? So a couple of questions about the isolation and the masking, and, should I still get the shot?
Yeah, well, these are very important questions. And in general, and I don't know the individuals here that could be, severely immunocompromised, and I don't know the circumstances. I generally, when I speak to my patients, I try to, encourage, safe behaviors to not be isolated. Like, for example, we know outdoors is a really good place to be. And I know this is not the place to discuss, COVID, you have a whole nother session, but I do think that there are certain activities and certain ways that we can try to become active, particularly in these summer months, because it depends on where you live. Maybe you live someplace wonderful where, it's still going to be warm in like November. But for me, I know up here in Boston, December isn't going to be pretty, and it's not going to be, it'd be a lot more indoors time and a lot less to do, if you're thinking about, concerns about, viral infections. So I would say, I never like the idea of isolating yourself so much that you feel like there's no additional benefit to a vaccine. I would want to have a discussion with your doc to say, hey, I think that's the question to have is how can you sort of find ways to, there are behaviors, we know so much now about these viruses, both flu and COVID and all the respiratory viruses we think about. We know about transmission, we know about situations that you can do. And I guess that's what concerns me most about this question is are you isolating yourself too much? And how is this impact going to be? Because I do think that, you have to be able to find ways to get yourself medical care, and that includes, vaccines. And, I do think that though I can't speak individually, and I don't want to make these individuals feel like they're doing something unnecessary, because they may certainly have the justification clinically, but I do feel like you want to make sure having discussions with your doc about, you know, what you may be able to do, because I think that's the bigger question here. Because I think there's ways to get the flu shot safely, and perhaps getting the flu shot also would allow you to think a little bit more about how you can have aspects of your life that can be improved, because knowing you have this added layer of protection.
Thank you. And recommendations for family members who don't have PI to protect themselves, and the one that does have PI.
Get the flu shot. That was an easy one.
Yes, it was. And question about the adjuvanted vaccines, and it is, do all pharmacies have that vaccine, or does one have to get it from their doctor?
I don't know if all pharmacies have them, but most should, because these are the vaccines that are indicated for individuals that are 65 and older. So that is a wonderful large slice of our population, and so there's a lot of folks that qualify for this, and so it shouldn't be that hard to get. Now the question is whether you can get it because you're not 65 and older, but you're immunocompromised. Usually, I think that involves going to a doc's office, you know, but it might be different in your area. I tend to be the one that, because basically the patient will come to me for their flu shot, and you know, and then we will give it, and we'll be able to give them the one that we're speaking of here. So it's probably easiest to go to your doc, but in some cases you may be able to get it from a pharmacy. They're certainly going to stock it.
So if you are 65 and you go into your local pharmacy and get your flu shot, do you need to tell them you're 65 and you want that special flu shot? Or
yeah, you shouldn't have to, but I think it's a good idea.
It out. Okay.
I would, you know, I don't, maybe I'm just not that trusting, but I would always double check and say, hey, which one do you give me? I'm 65 and older, and there's this one there. Just make sure the person who knows that it's there. They're not just, reaching into the same bin to get the same vaccine, but they should know. This is the vaccines that are given to those that are 65 and older. So they should know, but you never know who you get. Maybe I'm just, it's Mike Murphy's law, and you'll get the person that's, the last patient of their shift, and, they're not paying attention or something.
There have been talks about having an annual COVID booster mixed with the annual flu shot.
Cool.
What do you think? Will this be beneficial to be done together? Do we know anything about this?
It seems like you know more than me. So whoever's asking this question, I haven't even, heard of that. It sounds like a good idea, but I don't really know. I mean, it makes sense, and that's probably where we're heading with this. I think, again, you'll have a fascinating COVID session, and so much to talk about there. But that's, I think, what everyone hopes is going to happen. Is this going to become an endemic virus like the flu virus, something that we just get boosted coming into the season, and that's how it goes. And certainly, I think that's what we're all hoping to see once we get on the other side of this Delta wave. And so it makes a lot of sense. I personally like the idea. Boy, it would simplify things quite a bit to just get one vaccine and take care of both.
Would you, let's see here. Would you think an N95 mask like you would use with COVID to protect you from COVID is needed to protect you from the flu, or don't we know that?
Well, you know what? That's a really interesting question, in the sense that we kind of have some new data now about this, right? Because last year we really didn't have any flu, and last year we didn't actually have a lot of N95s like we do now, right? Last flu season, they were kind of scarce. So the data actually seems to suggest, and this, even though flu, you can look in the literature, there are many folks that kind of point that airborne transmission happens with the flu as well. The data seems to suggest that it kind of can be controlled by other masks, that theoretically are porous and can let this airborne transmission through, which is why with COVID, you never had that level of suppression like you did with flu. Flu was just gone when we put all these public health measures into place. COVID was much, was trickier because a lot of it is these small particles that can find their way through things and linger and all of this stuff. So it's certainly, I think the data is pointing that the N95 probably isn't as important for flu. I mean, I think we know that now after this past year, but maybe an expert would, argue, and certainly there's some literature to point at the airborne transmission, but it doesn't seem like it's as significant, certainly as with COVID and just based on last year.
Thank you. We have answered all the questions that we've received, and I learned a lot. Amazing information.
Great.
Thank you. Thank you from all of us for volunteering your time, for being here, answering these questions. And if by chance somebody submitted a question and we did not get to it tonight, feel free to send your question through IDF, IDF's website to Ask IDF, or for sure, ask your healthcare provider, because they know your personal health history the very best. And at this time, again, thank you, Dr. Maglione. And I will turn things back over to Adam. Take it away, Adam.
Sure. Thanks again, Dr. Maglione. Great job. And thank you to our featured sponsors. Thank you all for giving your time and sponsorship. And we're honored that you've been able to join us and share information about your resources. Yeah, so once again, thank you for joining us tonight. We hope you found this information that was presented helpful. Please remember, IDF is here for you every step of the way on this journey, and we hope to see you next time.